All right, let's get started then. So welcome everyone. Thanks for joining us today for today's Kirby Institute seminar. My name is Ben Babington. I'm part of the HIV Epidemiology and Prevention program here at the Kirby Institute, and I'm the chair of the seminar series committee. So in this very special week of NAIDOC, I would of course like to begin by acknowledging the traditional custodians of the lands on which we are all variously gathering today and pay my respects to their elders past and present. So for me, I'm on the unceded lands of the Gadigal people of the Eora Nation. And I extend that respect to Aboriginal and Torres Strait Islander peoples joining us here today. So before we begin, I'll start off with some housekeeping. So the format for today's seminar is a little bit different to what we normally do. So we have not one, but two very special guests today. And the main part of today's session will be a conversation between those guests, followed by a chance for audience Q&A at the end. So you can ask questions throughout the conversation between our guests by clicking on the Q&A icon at the bottom of the screen. And please go ahead and pose questions throughout the session. So you don't need to wait until the end. And then I will look at the questions that are coming through as throughout the session, and I'll pop back in at the end to facilitate the Q&A. So I'll just introduce our two guests. So our main guest today is Dr. Alegra Wolter. Alegra is a physician from Indonesia with diverse experience in medicine, community advocacy, health technology, research, and education. And she currently has a few different jobs. She works as the head of partnerships engagement at Dokwudi, Indonesia. She's a general practitioner and chairwoman of an organization called Suara Kita on their advisory board. Alegra was known publicly for her community work focusing on multiple mental and sexual health campaigns, particularly within the spectrum of sexual orientation, gender identity expression and sex characteristics, HIV and women's health. And she's also a champion and advocate for transgender visibility and rights, and is Indonesia's first openly transgender doctor. So for this special In Conversation seminar, Dr. Wolter will be joined by Adjunct Lecturer with the Kirby Institute, Mr. Teddy Cook, who is one of Australia's fiercest advocates for trans and gender diverse people. Teddy has over 15 years of experience in community health and non-government sectors. He joined ACON in 2012 and is currently acting as the Director of Community Health, where he oversees client services, LGBTQ community health programs and pride training. He specialises in community development, health promotion and program delivery, and he also led the development of Trans Hub, which is a fantastic resource that everyone should check out, and the establishment of the ACON's Trans Health Equity Program. As I said, Teddy is an adjunct lecturer with us here at the Kirby Institute at UNSW, and he joins ACON's senior leadership team as a proud queer man of trans experience. So today, Teddy and Alegra will discuss the health, community, rights, and experiences of transgender people in Indonesia, and what can be done to support the progress that is needed. So over to you, Teddy, to start the conversation.
Thank you so much, Ben. And it's just so wonderful to be joined here today with you, Alegra. I've been really looking forward to spending some time with you, and we've got so much to talk about and so much ahead of us as well. Before we begin, I also would like to acknowledge country like Ben did. I acknowledge the elders, I acknowledge and pay my respects to all Aboriginal people, to all Torres Strait Islanders across this great continent that we find ourselves on, and including those with heritage from the South Sea. I joined today from Gadigal country, and that's one of the 29 clan groups of what is often called Eora, the Eora Nation, and it's Gadigal, which the Gadigal people, which was where invasion first started. I also wanted to acknowledge our sister girls and brother boys, Aboriginal trans mob, for they are indeed our past, present, and our future. I acknowledge all Aboriginal people. As I said, this always was and always will be Aboriginal land. One thing that we often hear is that this place, Australia, is home to the longest living continuous cultures on the planet. That means that this place is also home to the longest living trans cultures on the planet. And that's a pretty special thing to be home to, and something that we must always remember. Alegra, it's such a delight to meet you. This is the first time.
It is my pleasure. This is the first time that we talk officially online. Previously on emails and Instagram DMs and WhatsApp.
You are everywhere. It's been so wonderful to meet you, to get to know you a little bit. We're about to start our adventure together, heading to the AIDS conference in Montreal, where we'll get to work together some more. But I really want to hear about you. You know, I think that it's so important that we do everything we can to elevate trans women, and particularly trans women of colour. I feel so honoured to have been asked to speak with you today, and I haven't shut up yet. You haven't even said a word. So I've got a question for you.
Yes.
You're living in Indonesia, and, you know, I'm really keen to hear what life is like for our communities in Indonesia. You know, what are some of the key things that are going on that, you know, you'd like to talk about? Super keen to hear, of course, about trans women, but also really, you know, whatever you'd like to share regarding trans men or non-binary communities, go for it. We'd love to hear.
Yes. Thank you so much, Teddy. First of all, I would like to thank University of New South Wales as well, Kirby Institute, ACON as well, Teddy here. You know, I'm a big fan of Trans Hub, and I think it's one of the best reference in Asia Pacific, alongside with Asia Pacific Transgender Network's website as well. They do provide quite comprehensive information regarding trans health, community advocacy, and everything related to that in one-stop platform, because we know firsthand that how hard it is to gain data, especially from developing countries. As a researcher, it's quite hard to capture those marginalized experiences, because it's not very well documented. And even if it was documented, usually it was through university research or, you know, thesis, but it is not as well published as Trans Hub or APTN's website, if I can add. And I think in general, in Indonesia, coming from the healthcare background, for transgender community itself, we see inclusion in terms of HIV program, but there were significant lacking in terms of access to proper mental health, for example, and also transition-related care, gender-affirming care, and HIV care. Sometimes we're starting to roll on PrEP now. So imagine if Australia is already, you know, having PrEP mainstream, and even in other countries like in Thailand, for example, it's already more mainstream, but now we started to enroll on PrEP. So you can imagine like the sort of the time dimension different. We're living in the same time zone, but the progress is quite will be quite different. And I think the overall barriers will be related to the stigma and the discrimination itself towards sexuality in general. So in some conservative countries, such as Indonesia, sexuality, the concept of the gender binary is being uplifted as something that's sacred and related to faith, religion per se, and it is embedded in the social norms. So in those patriarchal views, cis heteronormative views, it is hard to be to live as someone who's different than the general population. So you got to break through the small steps and all the cracks to be able to survive, basically. And I think in healthcare, when I mentioned that it is included in HIV programs, mostly on trans women, they don't recognize much of the needs of trans men as well, because we've seen trans men who have sex with men as well. Other than that, the transition-related care here is quite bare minimum, if I can say, because there are not much of centers that try to help trans individuals. In the past, I think it was in the 70s, if you ever heard of Vivian Rubianti, she was the first trans woman to legally change her sex identification in her ID card, and she had to went through to the court, to the higher levels of Indonesian court commission through that process, because at that time there is no law that supports trans individuals to change their legal sex identification. And after that process, the law enforcer, they try to select several hospitals, center hospitals in Indonesia to help with trans patients. But nowadays, it became increasingly more conservative, that there are several centers that are not as accepting as it used to be in the past. And sometimes they only accept intersex people to get help, because I think there is this understanding that if you're intersex, then it's not your choice, and they want to confirm. So it's basically derived from the understanding that everyone should be conformed into traditional male and female gender role. So they want to help intersex people, but access towards transgender individuals, sometimes they were being rejected through these institutions. And I do have patients who have to travel through different cities to gain proper care here in Jakarta.
Why are they rejected? Are they rejected because they don't fit a particular model of what it means to be a woman or a man?
To answer that question, I think there were several factors. The most important one would be in the structure level. There were no proper documents or even guidelines that stated the needs of transgender people in the national level, and also only in some institution, like 1 or 2 institutions in Jakarta that I know that provide care for trans individuals. But in other centers, they don't have that sort of regulation policy structural level. And on the other hand, the providers, sometimes they do have their own personal values, religious values usually, then they feel like they don't want to treat a trans person because it means like they are changing the way they were supposed to be as a natal birth male or female. On the other hand, the third point will be some of these experts, they are not aware that there is a need for trans patients and what kind of need. So they are not familiar. So they prefer to refer them or not to treat them at all. I think that's quite interesting because even though there are several doctors who are willing to help, but they don't know how to and the correct steps to do that. So it requires like extra activism level of insight to be able to understand, because so there's a huge gap between these providers and the community, right? Like they never interacted with the community unless they were part of the community as well. For example, like a gay male doctor. But even that being said, we also realized that in Indonesian culture, it is harder for these professionals to be open in their practice, and sometimes they do feel like they don't want to share their sexuality, which is I think it provides like a barrier as well on the personal level to connect with patients coming from diverse gender and diverse sexuality. So those were the things.
So much going on.
Yes. And on the mental health level, I think this is much deeper because the root of discrimination came from stigma and pathologization of trans individuals. And when I mention pathologization, we acknowledge that for a long time, mental health diagnosis has been used as a tool to devalue other human being or try to, you're crazy to a woman who experienced sexual abuse, for example, in the same way that it has been done through the LGBT population in the past. Now it has been done, still happening as well right now. I think in Indonesia, they try to label gay people as mentally ill or trans people as mentally ill, and they need conversion therapy per se. And the irony is that there are several experts in the field of psychology and psychiatry who still believe in conversion therapy. So there is no strict leadership on that. And I think that on the activism level, we want everything to go fast and according to the most modern way. But on the practical level, it needs a lot of advocacy, like a subtle approach towards the government, Ministry of Health, because it's a very sensitive topic and not a lot of people are brave enough per se to bring those conversations up. And even in the medical associations level, in the psychiatry, I think right now they're supposed to create like a new guideline, like the Indonesian version of DSM based on ICD-11, but I'm not sure about the progress, but it hasn't been done yet. So we still have gender identity disorder, but there right now, the progressive ones are trying to use gender dysphoria, gender incongruence, like a more inclusive terms. But there are still people who still believes in the stigmatized way of viewing gender diversity and even sexuality sometimes. So the progress has been quite slow, but I think the newer generation of experts, they are trying to be more open towards this population. But it's just that we haven't had like in Thailand, you have, I think I really admire Tangerine Clinic, if I can mention, like they have like a comprehensive, and it's supported by government as well, international, national fundings.
Yes.
So it's really sustainable and more than just one doctor is working on that. There are cisgender people, because sometimes I do feel like there is this belief from cis colleagues that I have just because I'm trans, like it's supposed to be, you can lead this. I mean, like I will do my best, but there is some limitations as well, because I cannot do this on my own. I need allies and other people, cisgender people, trans people, communities as well to make that happen. So the question will be, is it going to be like a top-down or bottom-up approach? I think it really depends on the people that we're able to work with, because I believe that true inclusion should start top-down, especially, but it will be much easier if it's in companies, because it's a smaller scale. But on the national level, in this case, I think it can be started bottom up through the community. But at the same time, there is a need to advocate from the top as well.
I wonder if that kind of meeting of the sort of grassroots to pressure that top-down sort of advocacy approach, that where we need to build relationships with the policymakers, so that, what I'm hearing, and so much from what you've said, I really relate to here in Australia as well. Access to gender-affirming healthcare can be a real challenge. Accessing hormones, surgeries is really, really hard here. There are a number of clinicians who are actively providing conversion therapy or conversion practices for trans people. It's remarkable that, and then in other areas, we've got legislation seeking to ban, legislate against conversion practices. I'm also wondering, you talk about, that experience of pathologization and stigma. And in Indonesia, can you tell us, and this is so not on the questions that I was going to ask you, just so that you know, but I've gone already. Can you tell us a little bit about what you know of trans history in Indonesia? As I acknowledge country just before, I talked about sister girls and brother boys, Aboriginal trans people who have always been here. We see
part of the culture.
Yeah, we see the trans experience across so many First Nations across the world. Do you know much about the story of Indonesia and where gender sort of manifested?
Yes. Maybe, I think I can share some of the stories that I've read and also the things that I've learned from my fellow anthropologists. I think in general, gender and sexual diversity has been in a lot of cultures in different parts of the world, especially in Asia and some indigenous populations. And you mentioned before, sister girls, brother boys. And in Indonesia, we do have terminology for people in Bugis, for example. They do recognize 5 genders. I forget the full name, traditional name for that, but they do have bisu, which is like the gender neutral priest, some sort, and they do help a powerful position in the community as a spiritual leader, because they were believed to be the bridge between the physical world and the spiritual world, as they identify as a neutral, gender neutral individual. And they do recognize trans women, trans men as well, chalalai, chalabai, makunrai, and another one for cisgender men and women. And in other cultures as well, in Java, they do recognize, in a lot of dancing cultures, they do cross-dress, and as well as part of the culture as well during the colonialization, and it develops over time, like reok, for example. Usually there will be like an older person who is supporting or mentoring like a younger male, and usually take that person as a lover, some sort, if I'm not mistaken. So there is diversity in our culture in terms of gender and sexual fluidity. And I think in Indonesia, if anyone ever travels here or have an Indonesian friend, you might heard the term waria for trans women. Nowadays, the modernized one will be transpuan, which is the same. Trans but puan, perempuan means women. But waria itself is a name given by one of our late Jakarta governor, Ali Sadikin. Originally, it was named Wanita Adam. Wanita meaning women as well, same with perempuan, but perempuan is a much more proper word to address women here, because it's derived from the Sanskrit word, meaning that someone that is respected, puan, while wanita means like someone who is the subordinate of a man. So it will be much more proper in the feminist movement as well in Indonesia to use perempuan. So wanita Adam. Adam is like the Adam and Eve, Prophet Adam in Muslim religion, culture. So because it's a name of a prophet, they try to change that. So wanita pria, kind of like lady boy in Thailand. But in a lot of ways, the term transpuan is, I think, being popularized in the past few years, like 4 years, if I'm not mistaken. And I think it's the form of opportunity for the community to take ownership of their own identity. So they are not named by another person.
Yes.
They take the name transpuan, and also transpria for trans men, transpria, trans laki-laki, and sometimes they do have terms for priawan. And priawan will be the trans men population who feel like they don't need to have certain surgery to validate their gender identity. But I think at the end of the day, however, whatever you want to identify yourself, I think it should be based on respecting on what the other people want to be named as or identified as.
Yes.
Yes. And I think that our irony is that during I think it was in 2016, in the past, after the US Supreme Court legalized same-sex marriage, throughout the US, there were a lot of debates on marriage equality, and in the Indonesian government and society are very sensitive to that topic because the narrative, sometimes they don't even mention the narrative of same-sex marriage. They mention, is it legal to be LGBT? Like, of course it is legal to live, otherwise I'll be shot dead. Of course it is legal to be who you are because there is no law that perpetuates same-sex relationship, consensual ones. But the narrative over the past years, they try to be to package like a more conservative, and I don't like to use the word conservative. I think it's bigotry, because conservatism is more like you're preserving some values, but I think they do preserve more of a bigotry rather than conservative values. Yeah, they try to package the more bigotry, more conservative movement as a family unit law, for example, like ketahanan keluarga, like family resilience, which also includes sexual deviance, including gender and sexually diverse people, which is, I think that a lot of LGBTIQ plus individuals are very good functional members of their community and their family as well, which I think that's the irony here. But over the past years, I do see the younger generations as well getting more and more aware of these topics, especially the more educated they are, the more likely they are able to grasp these concepts of diversity and respecting one another. But the education system itself, a lot of it still has some sort of indoctrination, if I may say, on the concept of the rigid concept of sexuality in general.
And I'm really curious about, we often hear in our trans movement about the kind of application of Western ideas of gender, and I sometimes wonder, given the richness of non-white cultures and gender, you talked about at least 5 genders being recognized in Indonesia. Sometimes I wonder if it's the West that has completely misinterpreted the expansiveness, the reality of gender, which is one of much more myriad wonders. We hear terms like trans, and trans was a term that was given to us as well. It was applied to us. Terms that we created for ourselves are terms like man, woman, non-binary, I'm really kind of curious to hear from you on, this sort of incessant sort of Westernization or kind of global north consideration of the trans experience. It doesn't seem that helpful to me. I'm curious to hear from you on, it seems to me that we should be thinking more about our sister girls and brother boys and, the 5 genders of your country and the wonders elsewhere than, a cis-binary Lord. How limited.
And I think it's a great thing if we can amplify the voices of minorities who identify as different genders across different cultures, because at the end of the day, gender is a social construct. And, I saw some articles in the past about the end of gender binary, but I think it will be it's like a huge question. Is gender benefiting us, or it is not benefiting us at all? Because I think each of us, each of us has a tendency of, for example, I do consider myself, I like to be a feminine person. I like to be, being taken care of, for example. And, there are people who like to take care of other people. They like to be the masculine version of, the social construct itself. But there are people who doesn't feel like they need to identify themselves in those roles, and that is okay as well. I think in general, in some cultures, we are being pinpointed towards the binary spectrum: trans men, trans women, cis men, cis women, and I think I do notice that in Indonesia as well, sometimes trans women are, especially those who are passable in the society, they seem to have like a good image. They are more likely to be accepted than sometimes the gay men population holding hands together in public. So I think when you mentioned westernized idea, in the Western, at least in the American concept, I think, I don't know about the Australian concept, maybe they can share later on, but in the American concept, the LGBT rights movement will be the rights to marriage equality comes first, and then after that, the rights of the transgender movement after that. But in other cultures, it's not always like that. It could vary. I want to give an example. I think it was in Iran or Pakistan, I forgot. Like they do give proper treatment for trans individuals. They do give access to hormones, free surgeries, supported by the government, but they don't support gay men. They want, the mindset is that they want the gay men to be a woman. So they want them to conform into the binary spectrum of gender and fulfill the cis heteronormative role. And in Indonesia as well, the trans culture has been here for quite a long time. We have trans celebrities, Dorce Gamalama in the past. She passed away. Yes.
You're a celebrity. That celebrity called Alegra Wolter.
No, I consider myself more like activist or something. But the Dorce Gamalama and also some other trans figures who are very, accepted, I think, in the past. Over the past years, we do notice some backlash and also some, struggles towards human rights in general, women's rights, LGBTIQ plus rights. And I think the level of acceptance sometimes can be determined by the concept of heteronormativity. So I think the challenge will be how can we challenge the rigid gender construct and rigid sexual identity construct, because I think it is much more wiser to highlight that while at the same time highlighting the diversity. When you mentioned the different perspectives between these Western or maybe like the colonialized version of gender sexuality, yes, it is embedded in our culture as well. But at the same time, right now we notice that in different countries could have different kind of strategic approach. But I think in general, I think in Asia Pacific and in some other countries, we do notice some similarities. So if we want to tackle the main problems, will be the stigma, because they don't know the difference between sexuality, gender, pathologization as well, and maybe some the lack of respect. I think because you can have your own values, your own religious beliefs, but it is much better if you're not instilling that to other people. So it is more like a systemic approach to that.
I think
that answers.
Yeah, look, it's our vision for trans liberation is exactly the same, really. Yeah. Where we can self-determine who we are. We have agency over our bodies, and we are the ultimate authority in who we are. And I think I'm going to change tack a little bit, because I've really loved this conversation so far. I think, one of the big fights or the struggles, the progress that we've been trying to make here in Australia has been kind of repositioning gender affirming healthcare away from the lens of it being specialist medicine.
Yes.
And, you know, really belonging so beautifully within primary care, you know, for GPs to be able to be supporting their patients in the ways that they want to. And we've had good success, you know. But, you know, we often focus on the challenges, and for good reason, you know, across our entire world, trans people, and particularly trans women, are our most minoritized women on the planet. And, you know, I think, though, that there is also incredible gender euphoria in trans communities. There is so much that our communities are winning with and staying resilient around and rising up to meet so many challenges. And there's been many. I'm keen to hear on what gender euphoria looks like for your communities in Indonesia. What are the wonderful things that are happening? How can we kind of hang on to that for our own work, and as advocates, how we kind of maintain that strength to keep going?
Okay. I think on the individual's level, gender dysphoria can mean a lot of things to a lot of people. And I think it is also challenging the concept of beauty, the concept of gender itself, and how you represent yourself. Nowadays, I've seen people who identify as non-binary, they, them, or other pronouns, there, for example, especially in the younger generations. And some people who are quite very liberal, very hipster in the older generations as well, they do identify more in the gender neutral spectrum. And it was great to see that, because in the past, we might be more dichotomized into the binary spectrum in general. So on the individual level, it might mean quite different from one another, the concept of beauty. In the community level, I see more trans organizations and other LGBTIQ plus organizations who want to highlight the needs of trans community, trans individuals in general, whether it's healthcare, the right to access education, the right to access legal identification, the right to access jobs, work, because it's quite important. In general, I do notice that trans men and trans women are both discriminated, but sometimes in the patriarchal culture, mostly in the world culture is very masculine, very patriarchal, and they try to, they feel like if you are transitioning from male to female, it's like lowering your level, while you're transitioning from female to male, it's like upgrading your level. And I think in a lot of sense, trans men are discriminated as well in Indonesia, but trans women, especially those who come from a more marginalized intersectional background in terms of economic, education, environment, social situations that they had, they are more likely to be more discriminated. And in the healthcare level as well, the positive sides will be, I do see some doctors who are willing to help trans individuals, but we haven't had like a good system as in Australia or even Thailand, for example. They have their own centers. We do have several centers who help, and it consists of several different specialties. And it's true, it's very specialized. And because the GP doesn't have that competence, and the level for the level of competence for gender identity disorder only embedded to psychiatry. So you can imagine, because the treatment for gender dysphoria is gender affirming care that includes hormone surgeries and social transition as well, right? It cannot be only psychotherapy for the rest of your life. It should be something practical. And in that sense, I think we're navigating like a limbo, because there is no regulation. So you have to create your own system, your own support system and network. And I think seeing Trans Hub, I think it's a really good example. Hopefully we can replicate that in collaboration, perhaps in Indonesia.
Yes.
because online platform, I think, is the best, one of the best way for trans individuals, especially the trans youth, to access healthcare or information, because they don't receive that in schools. Although we're trying to embed it like inclusive, comprehensive sexual reproductive health education, but the practical level, it's not touching the gender or sexual diversity at all. Maybe touching like consent, bodily rights, concept, the traditional concept of gender, sex, but it hasn't really been touching the concept of diversity or sexuality in general. And in the government level, I think it really varies, because in a lot of ways, the LGBT topics are sometimes being used as a political tool. So usually I think there is a research on this, that for example, if you live in a progressive country, you can use LGBT topics as a way to get more followers, because it amplifies inclusivity and so forth. Hence, there is tokenism in companies, in political parties, and so forth. But in more conservative society, you can use LGBT issues because it's easier to hate, to gather a community, to hate other community. You know, it's like the strategy to use hate as a political campaigns, right? But on the personal level, I don't think that they care about LGBT issues at all. But it creates, on the society level, it creates hate. And it's not healthy.
I think you're absolutely right. I think, you know, the movement that seems to be quite a big anti-trans machine, as much as there actually really aren't that many people, actually, you know, they're very loud. And interestingly, most of them seem to be cis men who are most opposed to trans rights and inclusion. But I'm wondering about, you know, what are the kinds of initiatives that you've been working on in Indonesia that you're proud of and you want to tell us about? I'm super keen.
Yeah, I think I would like to acknowledge my trans LGBTIQ plus communities as well here in Indonesia, because those were working with I work more with the NGOs, the community organizations, and they do have lots of programs. The new one will be on PrEP, HIV care as well, and it has been quite progressive for HIV care. But sometimes the other care for gender affirming care in puskesmas or the local health centers are not as inclusive towards other level of care, although they do recognize and they really interact well with the community, but they haven't got the right training and also proper regulations to help care for trans patients in gender affirming care or inclusive mental health, maybe, because some centers do have psychologists and some of them are good and quite evidence-based, but it is quite subjective because it's not like a structural level. It's based on individuality. If that person is accepting, then it's great. Then if it's not, then it's horrible. You'll be, you know, blamed for your gender or your sexuality.
Like a lottery, trying to figure
like
out.
a lottery, which is the irony, right? Because the goal is to build like a more inclusive system, not just networks of inclusive practitioners. It should be the whole society in general. And other than that, I think the community with Suara Kita, we do have some projects with helping trans individuals accessing health insurance as well as legal ID identification. And this is specifically working with the marginalized trans women. Sometimes they have to went out of their home quite early, very early during their teenage years or early 20s in their lives, and they don't have any much access towards their legal ID card or family card, because in Indonesia you have family card and then your legal identity card, and your legal identity card should be match to your family card. So the concept of family is very strong here, and not a lot of families are supportive towards trans or LGBTIQ plus individuals. We're working on that to give more access, and the access could mean a lot of things, because for a lot of people it's easy for them to access this type of services, but for some trans women they don't prioritize this because they live in a survival mode every day. They don't see it as a priority until COVID-19 hits, and it became very important to have legal ID card because you need insurance, you need to get vaccinated and so forth. And other than that, I think in general, it is bridging the barriers between the provider of the administrative office from the government to be more accepting and facilitating the needs of trans individuals, because sometimes they don't have, they do live nomadically from one place to another. It should be facilitized because it's the term equity, right? Yeah, because everyone has different needs, and sometimes the condition from one community or one individual from another, it's different, but they should be able to get the same rights. That's the thing that we have been working on over the past 2 years, I think, in general. And I think right now we are also launching the BPJS Tenaga Kerja Insurance. So the health insurance here consists of 2 parts. The one for your health. If you're sick, you can access health insurance from the government. And another one will be, usually it's a paid one, but it's very cheap. And if you pass away, you can get, your family could get money from that. And in this program, that money can be used as the money to have a proper burial for trans individuals. Because in the elderly population, sometimes it's even harder for the elderly population because they don't have, if they don't have like a social support system like families who want to bury them, usually it was the community. And right now, in some communities like in Jogja, Jakarta, and some other parts of Java, the community do fundraising if someone passed away. So it was like an aftermath. But with the insurance, it was preventative. So we help to pay the insurance through donations. And if someone passed away, you can use the money, which can be claimed like 2 weeks after the person passed away to for the proper burial system. And the rest of the money can be used to help other people in the future. So that's the strategy. I'll share the banner with you, but it's in Indonesian. I'll ask the team to create it in English as well.
The you know, the trans community globally works so hard together to get the needs that, you know, to get our needs met. You know, whether we crowdsource so that we can respectfully bury our community members, crowdsourcing to help people access.
And also for funding as well. In Indonesia, most of the funding came from the HIV program. But the needs for trans patients, sometimes it's not only HIV, right? It should be the overall well-being in general, the geriatric problems, the youth problems, and sexual reproductive health in general, mental health. I
think when we can't access the care that we need, and, you know, recognizing gender affirming healthcare as life-saving medicine, you know, that HIV care can be a significantly lower priority when we can't get the basic care that we need, you know. So I really, that is very strongly replicated in
it's a progress, it's step by step, but hopefully we can always evolve, right? Like I think in a lot of sense, it's great to have research, because through research we can build advocacy plans, but at the same time it's good to build programs as well. There is very strategic in accessing the need, navigating the needs of trans and gender diverse individuals across different intersectionalities and identifications. And there is a strong investment in terms of training for our experts, our healthcare practitioners, and even those who are working in the leadership position. Because I think in general, we are being constantly challenged by our gender.
Yes.
If a man, should a man cry if he feels sad, or should a woman be able to work independently, or you know, some conversations can be as absurd as, should it be okay to have no child? And those kind of things is the challenge that we have to navigate nowadays. And I think we're all being faced, as a population, we're being faced by the concept of gender. And I think it's good to be able to put trans conversations into that, because we do experience transitioning from one gender to another, and we do see these different treatments. If you are a male, when we're living as a woman, and when we are living as a man.
I think there's something so special about the trans experience that, you know, I know that I'm very biased, but I love being trans. I wouldn't want to be anything else. I'm glad to hear you say that. I'm glad to hear that.
Because the narrative is only sad stories. That's why I'm glad that you bring up the conversations that what's the positive thing, because in a lot of ways, and you know, in some interviews that I had, I always tell the journalists to not portray this as a sad story, more like hope and what we can do as a society, and it should transcend more than just my story, but the story of community in general. Because I feel like a lot of minorities in general are tokenized into like, this is the ideal representation of a trans woman or a trans man or this person with disability, for example. And it's not true, because there are different faces to different communities. And as a minority, I think in general, we tokenize a lot compared to the general population.
I think you're right. I've got one more question for you, and I know that Ben's here and we're in Q&A to do in only 5 minutes, but I want to hear, Alegra, what's bringing you trans joy at the moment?
Trans joy? I think it's the community that I serve, the people around me who supported me, and my work that I've done. And I think when Ben mentioned I do have a lot of roles, I think in the past, hopefully I'm still in the process of applying to several roles. That is, so I can transition back into community work fully in the organization. Maybe in the future I'll update that. Like, I'm still in the process, but you know, I've been looking forward to work more on the advocacy community level, on the structural level, because one doctor is not enough. I mean, like, I can help individually, but it's more inclusive if we can change the system step by step through healthcare, for example. What brings me joy are the people around me and the progress that I've made. And I remember when BBC interviewed me earlier, or last year, I think early this year, to highlight my story. Previously, I often shared, but as a medical professional, not as a trans physician, and they want to highlight that. And I remembered when the article launched, I remember, oh, this is quite emotional, because I remember the allies that really supported me, LGBTIQ plus individuals, and also people who don't identify as LGBTIQ plus, who helped me towards this process. And I think that as a society, we cannot stand together. We cannot stand alone. We should stand together as one, because we're challenging the same system of gender and the restricted beliefs of sexuality.
We are so much better and stronger together. And I often say that I think the trans experience is a gift. And I think you're a gift. You're a gift, Alegra, to our movement.
Same
and to
to
the
you.
Communities in Indonesia and across the world. It's been such an honor to spend some time with you today. I wish I was with you, giving you a gigantic hug right now. I just think you're incredible. And I'm so excited about going to the AIDS conference in Montreal together.
Yes.
Watch out, world. Watch out, world. Of course. Now, we've got a few minutes left. Now, Alegra has to leave bang on out on the hour.
Oh.
It might be best, guys, if we just wrap up there. I mean, I think that was a really lovely end anyway. Just to particularly hear, Alegra, that you've had such wonderful experience of support from people within your community and outside. And I think that's just a lovely way to end. We did only have a couple of questions there just for everyone to know what they were. One was around, there's been some really great work in Thailand, some really, really big public facing campaigns about trans women and PrEP. And I think someone was just wondering what Alegra thought about that in terms of whether that could ever kind of work in Indonesia, or if there's anything like that in Indonesia. I think it'd be a little bit harder, but maybe not impossible. And then another one was just around how we as Australians could support the work that's going on in Indonesia. I don't think we'll have time to get into those now because Alegra really does have to go straight away. But thanks for those questions. If you do want to reach out to Alegra directly, please do if you want to find out her answers to those. And she's just given all of us her email there.
Email me. I think if you have any questions, if you want to be connected with communities here, I'll do my best to connect you.
Great, thanks so much. And of course, so huge thanks to Alegra for just your insights and just your willingness to come along and speak to us today, but also to Teddy. Thank you so much, Teddy, for being such a facilitator of that conversation. I just felt that it was really important to, why don't we just hang on after everyone leaves and we'll do that. But I just felt that it was really important that this conversation really happened between two out and proud, fierce warriors of trans experience. So thank you so much for the two of you for that today. So that's it, everybody. If you'd all like to jump off the call, we'll have a little photo here just of the three of us, and then we'll see you all next week. Thanks, everybody.
Thank you so much, everyone.
Thank you all.
Ready, Ben.